Hello, I'm Mary Jane Tackey. I'm a consultant psychiatrist in Newcastle upon Tyne. Eleanor is a 23-year-old single unemployed lady who lives with her parents and brother. She's just had her first admission to hospital. Eleanor had a long period of untreated psychosis, which was characterised by prodromal symptoms while she was at school, and then later the development of frank psychotic symptoms in her late teens and early 20s. Eleanor has schizophrenia. Her symptoms are a complex delusional system where she and her family are parts of a film and she is the main star. She also has command auditory hallucinations and also suffers with negative symptoms of schizophrenia, in particular social withdrawal and poverty of thought, and has some cognitive impairment. She has little insight into her illness. Another complicating factor for Eleanor is the environment at home, which is characterised by high expressed emotion. She feels that her parents treat her as a child and are critical of her. Eleanor's illness is complex. She has a combination of symptoms, she has limited insight into her condition, and there are other factors at home which maintain her condition, high expressed emotion. Treatment is therefore a challenge. In this programme, I will talk to Eleanor about the consideration of a long-acting, injectable, atypical antipsychotic to allow her to feel that she is more in control of her medication, thereby reducing the high expressed emotion in the household that she finds the most difficult. Eleanor, can you tell me what your main problems are?
I know that you think that I've got schizophrenia, but I don't see that. I mean, at the moment I feel a lot better, and I just feel like it's not an illness.
What do you understand by the term schizophrenia?
Well, I know my mum's read up on it, and I know that it's people think differently to other people, but I don't see that it's real to me. I don't see it as how you see it.
Do you know how long schizophrenia lasts?
From what I've read, a long time, and I don't know, people say it can last forever.
And what's the treatment for schizophrenia?
I've taken tablets, and assuming that I accept that I have an illness, then the tablets they work, I suppose. I mean, I'm more relaxed and I can think clearer, but I don't like having to take medication. I don't like being controlled by a chemical.
And how long do you have to take the medication for?
Maybe forever, but I don't want to have to think about forever, and I certainly don't want to be on them any longer than I have.
What other elements of treatment are important to you?
There's a nurse I speak to. She's really nice. She seems to understand me the most, I think, and she's working with my mum and dad.
Okay. Maybe you could tell me what are your main difficulties at the present time?
At home, I feel really pressured all the time. Like, Dad just thinks I'm attention seeking, and Mum, she treats me like a kid all the time.
So what makes things better at home?
When there's arguments and things, I'll go in my room, and I know that a lot of time with myself isn't probably the best thing.
And what makes things worse?
Just the pressures, and maybe I will make mistakes if I make my own decisions, but I want to be able to make mistakes. I mean, surely that's what a normal person would want to do.
What can you or anyone else do to actually make things better for you, do you think?
I feel like for as long as I can remember, I haven't had control, and my mum makes me take my tablets all the time, and I don't want to take the tablets. I understand that they make me better.
Okay. I want to talk to you a little bit about medication now. What is your feeling about having to take medication? How does it make you feel?
I don't want to take medication. Some of the tablets I was on before were making me really tired all the time and dull and just sluggish.
Do you take medication for anything else? For example, if you had a headache?
Yeah, like I say, there's a link there. If you have a headache, you take a tablet and it takes the pain away.
What about, do you know the difference between taking medication for something like a headache that gets you immediately better and medication that you might take longer term to keep you well?
Yeah, if you have a headache, you take a tablet, and then if you have repeated headaches, then maybe you take something stronger or something that'll stop you getting these headaches. And I suppose it's like diabetes and people take insulin. So I do understand that.
And I think that's one of the things about the medication that you're prescribed at the moment. It's there for a long time to keep you well, a bit like the insulin and diabetes.
Mm-hmm.
I need to talk to you about what you want. So what would you like? What would help you the most?
I want to feel a bit more independent. I want to feel like it's not my mum in charge of everything.
Do you want to be more in control?
Yes. I mean, I'm 23 now, and I don't feel like I've had a life. I feel like I've been like this for so long, for longer than I can remember, and there are the things that I want to do.
Is it important for you to decide, for you to make the decisions?
Yes, of course it is, and I don't feel ill. It's me. It's my life. It's my reality, and I do want to decide what to do, and these are my mistakes and my life. It's my life. I don't feel like it is my life at the moment.
Eleanor, I want to talk to you about the possibility of changing the way that you receive your medication. The medication that you get at the moment, you take as tablets every day. Well, the same medication is available as an injection that you take once every 2 weeks. The main difficulty I hear you telling me is your lack of control over your treatment and your life, and your mum pestering you and feeling that you're not being treated like a 23-year-old.
Yeah.
Now I'm thinking if we were to give you the medication as an injection once a fortnight, you could take control of that. So there wouldn't be any discussion at home about tablets every day.
Yeah.
So it's the same medication, but just given in a